Kansas officials say there is not enough vaccine for everyone who wants it right now. Good evening. I'm Haley Harrison. This comes after the state is now entering into phase 2 of its vaccination plan, making this vaccine available to seniors and some others. Johnson County health officials say that they are also waiting for more doses, but could be starting phase 2 as soon as Tuesday. KMBC 9's Jackson Kurtz explains what this means for the county.
It will take a while for us to get through this.
Johnson County health officials are breaking up phase 2 of their vaccination plan into tiers.
This is a very, very large group. Estimate we could have around 150,000 persons here.
Tier 1 will include teachers, people over 65 years old, and anyone else who wasn't vaccinated in phase 1. After that, people who live in a group setting and can't social distance fall into Tier 2. And Tier 3 will include people who work at places like the U.S. Post Office and warehouses. Dr. Sanmi Areola says they prioritize these groups to keep up with the amount of people in phase 2.
The overall premise here is to give us time, spread it out into manageable chunks so that we are able to do this at a pace that is realistic.
If a person falls into phase 2 and has completed the survey, the county says they'll contact them to set up an appointment at their own doctor's office or elsewhere. That is, once they received more doses. The county says on Thursday they added a little more than 6,000 for phases 1 and 2.
We are going to be vaccinating at the Department of Health and Environment Tuesdays through Fridays. We are partnering with our area hospitals, health systems here, and health partnership clinics.
Jackson Kurtz, KMBC 9 News.
All right, little by little, we are learning more information here. If you live in Johnson County and you want to be vaccinated in a different county, state officials say that is a possibility. In Missouri, a vaccine distribution panel has learned that there's almost 178,000 more Pfizer and Moderna vaccine requests for next week. The vaccines are distributed based on a state's percentage of the U.S. population, and that means that Missouri gets 2% of vaccine production. As more medical professionals get the second dose of the COVID-19 vaccine, many say that they felt some side effects. So what are they, and how likely are you to get them as well? KMBC 9's Brian Johnson answering that for us tonight.
After the second dose of either the Pfizer or Moderna vaccines, doctors say nearly everyone will have a sore arm and may feel a little tired, mild symptoms.
It just felt like a regular vaccine, like the flu vaccine, the Tdap vaccine.
Dr. Tracy Johnson of Truman Medical Center says she felt more moderate symptoms. That's the case, she says, for 40 to 60% of people after the second vaccine. They can feel a fever for a day or two, muscle aches, and possibly chills and nausea. Others experience loose stools.
Really, really tired and having to take the next day off of work. That's what I'm seeing in a lot of different people. And
she says, like clockwork, if you feel moderate symptoms, they start 10 to 12 hours after the vaccine's second dose.
I had all those things that I just told you, and I know other people that had those exact same symptoms.
She says COVID-19 is far worse than any short-term side effects from the vaccine.
Depending on your demographic, you have a very high chance of being intubated, being hospitalized, or dying.
COVID-19 can lead to strokes and tracheotomies. Others can't taste for weeks. Long haulers don't return to normal for months.
If you are worried or apprehensive about getting the vaccine, go do your homework. Don't just leave it to chance. Ask your doctor. Go to the CDC. Ask different people in the community. Ask other people who have actually had the vaccine.
Brian Johnson, KMBC 9 News.
40 to 60% of people don't experience any symptoms aside from a sore arm. Doctors say that the vaccine is safe and it's effective. We have been checking with state officials on how many vaccine doses are going to waste. Missouri state health officials tell KMBC about 15 to 20 doses have been wasted since last month. Needle issues or clinics closing are the top reasons. Kansas health officials say 43 doses have been wasted due to vial shortages, expiration, or broken vials or syringes.
We've been really lucky of not having wastage. We've been able to go out and say, all right, we need to find, we're at the end of the event, we have 6 or 7 that we still need to give. We're able to go find demand to administer those vaccines.
Experts say that it's just not unusual for some amount of waste to happen during vaccine distribution. Both Missouri and Kansas report vaccine waste numbers to the Centers for Disease Control. KMBC 9 News, we know that you are having so many questions about the vaccine, about distribution, and we are trying to get you answers. We are posting on our website state and county specific information on vaccines from all of the local health departments, and that includes who will qualify for a vaccine and how and when to sign up. You can find all the information at kmbc.com/vaccine. You can also reach out to me on social media. Tonight, 186 new cases of the coronavirus and 5 new reported deaths in Kansas City, Missouri. The average number of daily new hospitalizations remains about the same across our 9-county area. It's down about 9% compared to the previous week. President Joe Biden's first full day in office is focused on combating COVID-19. The president signed 10 pandemic-related executive orders.
Our national plan launches a full-scale wartime effort to address the supply shortages by ramping up production and protective equipment, syringes, needles, you name it.
Dr. Anthony Fauci is now the president's chief medical advisor. He believes the United States can reach beyond the president's goal of 100 million COVID-19 vaccines administered in 100 days.
The concern I have, and something we're working on, is getting people who have vaccine hesitancy, who don't want to get vaccinated, because many people are skeptical about that. So we really need to do a lot of good outreach for that.
The president requested nearly $2 trillion from Congress to address COVID-19 and economic recovery. Some Republicans say that's more than taxpayers can afford. Leaders here in the metro urge Congress to approve President Biden's relief plan. $350 billion would go to state and local governments in federal assistance. The mayor of Lee Summit signed his support in a letter to congressional leaders, along with more than 200 mayors across the country. Kansas City, Missouri City Manager Brian Platt says funding is critical right now.
This funding for us is critical, that we get some relief here. And if not, we will end up needing to reduce services and consider furloughs and layoffs of our employees.
Platt told KMBC Kansas City had a $50 million shortfall this fiscal year and is looking at a possible $70 million budget shortfall next year.